I'm going to talk today about quality and safety issues as they pertain to the regulations coming down from different government agencies and the new laws that have been passed. It's going to be very important for hospitals, programs, and physician offices to be able to show what the quality is and what the safety issues and concerns are for their patients. Some of these things have to do with the procedures and the processes that are done at the hospitals and in the doctor's offices. For example, when one of the issues that came up in the past was wrong side surgery. And in order to decrease the occurrences, systems have been worked out where patients are marked, patients are told ahead of time what side is going to be operated on. And then once the patient is in the operating room, there is a whole system for the surgeon communicating with the team communicating with the surgeon, with what's going on with the anesthesiologist. This is an example that has already been worked out. But there are more and important issues for safety than just what the surgeon is doing. As another example, a surgeon comes in the room, wants to make sure that all the instrumentation is available prior to starting the procedure. In the past, it was frequently just set up, the doctor walked in, and it was assumed that everything was there. Today, systems are set up so that before each procedure, all of those instruments, medications, everything that's needed are checked off to make sure that it's there and you don't have a problem during the actual procedure that's going on. This is just one of really simple and obvious things that should be done. There are many others that we call a timeout in the operating room. How are these performed? It started just before surgery, and is it consistently followed? These are going to have to be tracked and methods developed for tracking that. That is something that we are experts at doing and providing and making sure that this occurs in the hospital setting. Now, this may also occur in doctors' offices. One example that I know of is e-prescribing for Medicare. And doctors now need to be able to prove that they are doing that or their pay is going to be decreased by a certain percentage. How do you do that? How is that set up? What EMR systems you have are going to be very important to be able to prove that you are providing that level of care. There's also the care in the hospital for patients and how they respond to what is going on in the hospital that is going to be followed. Such things as nursing organization, how nurses respond to patients during their hospital stay, how often, how frequently, how often is it missed. There are checklists of things that need to be set up and arranged to make sure that you are providing the quality and the safety that's needed in these circumstances. Another important aspect in a hospital and in even a surgery center and certainly in doctors' offices is the timing of the care and how it occurs. When the patient comes into the hospital, how do they get to the operating room suite? There are many, many steps that are involved in this, and it is important that it be done efficiently and appropriately with the patient feeling that this is being done for their care. This is something that everybody needs to consider and figure out exactly how to do. So how does a surgeon or a program or a hospital put these things into a systematic way so they can show that there is good outcomes, good patient follow-through, and patient satisfaction? There are many, many steps and many, many different methods of doing that. And all that information is available and would be very appropriate for the individual entity or the individual surgeon to learn about and to make sure that they're doing it correctly. It's going to be very important for each institution, whether it's the hospital, the surgery center, the physician's office, to understand all the appropriate steps to have the appropriate quality and safety that can then be reported back to the different agencies that are requesting this, whether it's through EMRs or any other mechanism, so that the appropriate pay is made and the appropriate care is performed. All of these things would be very important for the individual surgeon, the hospital, the program directors, to know how to implement, how to put in place in order to have the correct outcomes and be able to report this correctly to the correct agencies. They will find that their malpractice suits will go down. Their reputation will go up. Patients will be writing better things about the doctors or the hospitals online, and their pay for their performance will be better.